She noticed it on a quiet Tuesday morning. Her fingers, wrapping around a coffee mug, felt different. Not painful, not alarming, just tighter. She assumed it was the cold weather, or maybe she'd slept on her hand. She didn't think much of it. But weeks passed, and the tightness stayed. If you've never heard the word scleroderma before, you're not alone. Most people haven't. And that's exactly why it's worth understanding. Scleroderma is a rare autoimmune condition that affects the body's connective tissues. In simple terms, the immune system, which is designed to protect the body, begins behaving in an unexpected way. It triggers an overproduction of collagen, the protein that gives skin its structure. And when too much collagen builds up, the skin can begin to feel thicker, tighter, less flexible than before. But here's what many people don't realize. Scleroderma is not a fungal infection. It is not contagious. You cannot catch it from another person. It is an internal process, happening quietly beneath the surface. The skin changes associated with scleroderma are gradual. In some people, patches of skin may feel unusually firm or stiff. In others, the skin may appear shiny, particularly on the hands and face. The surprising part is, these changes can begin so slowly that many people don't connect them to a medical condition at all. They assume it's dryness, aging, or something temporary. And this is where things become important. Early recognition genuinely matters. Some of the early signs healthcare professionals look for include skin that feels tight or thickened, especially on the fingers or hands. Fingers that become unusually sensitive to cold, sometimes turning white or blue in cooler temperatures. This particular response even has its own name, Raynaud's phenomenon. Shiny-looking skin, reduced flexibility in the fingers, and in some cases, small changes around the mouth or face. Many people mistake these signs for something else entirely. That delay in recognition is one reason awareness matters so much. Scleroderma can affect people of various ages and backgrounds, though it is diagnosed more frequently in women than in men. It is considered a rare condition, but rare does not mean it cannot happen. Genetics may play a role in some cases. Environmental factors are also being studied. And while no single cause has been confirmed, research in this area continues to grow. This is one of the most important questions, and the honest answer is, there is currently no guaranteed way to prevent scleroderma. Because it involves the immune system in complex ways that are still being studied, prevention in the traditional sense is not yet possible. What doctors do emphasize is that overall wellness habits support the body's resilience. And crucially, early evaluation, when symptoms appear, can make a meaningful difference in how the condition is managed. Treatment for scleroderma is personalized. There is no single path that works the same for every person. Depending on the individual, doctors may recommend medications to support skin and tissue health, manage circulation, or address specific symptoms. Physical therapy can help some people maintain flexibility and comfort. Regular follow-up care is considered essential. The goal of management is not to overwhelm. It is to support quality of life and monitor how the condition progresses over time. Scleroderma is considered a long-term condition for most people. Symptoms may persist for years. But, and this is worth understanding, every person's experience is different. Some individuals have mild symptoms that remain stable for long periods. Others may require more consistent medical support. Only a qualified healthcare professional, through proper evaluation, can determine what that journey may look like for any individual. If you notice skin that is becoming persistently tight, shiny, or less flexible, particularly around the fingers or hands. Speaking with a doctor is a reasonable and important step. If your fingers show unusual color changes in the cold, that is also worth mentioning to a healthcare provider. Early evaluation is not about fear. It's about information. And information is one of the most powerful tools a person can have. Sometimes the body changes gradually, and those changes deserve attention, not fear. Scleroderma is a condition that science is still working to fully understand, but awareness, early recognition, and thoughtful medical care have helped many people navigate it with greater confidence. You don't need to have all the answers today. You just need to know where to start. If you found this helpful, subscribe to Ava Health Nexus for more evidence-based health documentaries.